Okay, getting back to the assessment of the visual system's subjective data, the nutritional metabolic pattern, vitamin C, E, and beta carotene are very important to the eyes, especially in age-related macular degeneration. The elimination pattern, if a patient is straining to defecate and performing the Valsalva maneuver, this is contraindicated when there's increased pressure in the eye or if the patient has had recent eye surgery. So those are some things to consider. Also, their activity level. Are they using protective goggles when they're engaging in using power tools or lawn equipment? And then sleep. Are they getting enough sleep so that their eyes can be, refreshed and bathed with fluids, or are they dry and sore looking? Patients with a vision loss may have self-image issues, and it's hard for some people to accept a loss of independence. The inability to drive a car can be devastating for some patients, and they will need support, family support, and of course help with ADLs and getting to appointments, the grocery store. Coping skills. Are they coping with this? Are they suffering from depression? You'll want to evaluate the different areas of the patient's life and see what needs we can meet. In this case study, we have a 74-year-old male who comes for an eye and ear exam. What are some reasons you may want to involve his wife, and how do you go about it? Well, for one thing, when we have aging patients, especially if they have visual or auditory deficits, we're going to need another party that will be involved in their care, that we can give information to and instructions to, things like that, to help with the patient care. If this patient looks tired and his eyes are sunken, what are some things that you should consider? Well, I would want to know if the patient is getting enough sleep. I would want to know if there was some type of visual deficit. You could take a pen light and do some basic tests with that. Test for accommodation with your finger or a pencil. So those are some basic things. You also may consider dehydration. Is the patient getting enough fluids? Objective data. This will be found on your physical exam. Checking the extraocular muscle functions and the light reflex. Those are things that we can do. Different vision tests, of course, would also be considered objective. The Snellen eye chart is one, and there are others. Sometimes if we have a patient that has a neurological disorder, or we suspect stroke, we may want to examine the 6 cardinal fields of gaze, where you ask your patient to follow your finger and you make like the shape of an H and watch and see how the eyes are able to follow that. We mentioned a little bit about PERRL. Here it mentions PERRL, P-E-R-R-L. It leaves off the accommodation function. So if you're not testing for accommodation, or if the patient is not able to demonstrate accommodation, then you'll want to leave that A off. Anoscoria is something that you may see in patients. That is where there is unequal pupil size. And that may be caused by different things going on with the eye, or it may be a neurological issue, such as in a post-stroke patient, maybe a type of a defect. I had a patient who had unequal pupils, and she told me that she was born that way. So always ask some questions and try to find out what's going on when you do see an abnormality like that. Mentioned earlier the protective structures, eyebrows, eyelashes, and eyelids. If a patient is hypothyroid, they may have very thin eyebrows and or eyelashes, something to consider. It may also come with aging. Here's a picture of the glands, again, the lacrimal punctum, lacrimal gland, lacrimal sac. Objective data, again, on the physical exam, assessing the structures, cornea, iris, retina, and optic nerve, those types of things. The cornea should be clear, transparent, and shiny. The iris should appear flat and not look like it's bulging. The area between the cornea and the iris should be clear with no blood or purulent material. And both irides should be of similar color and shape. In a small population of people, they may have two different colored eyes. They may have been born that way. It may be normal for them. A little bit more on macular degeneration. This is huge. This is something that's very commonly seen. It's actually the leading cause of vision loss, affecting more than 10 million Americans, more than cataracts and glaucoma combined. Macular degeneration is considered an incurable eye disease. Here's the Amsler grid test. The grid on the right shows what a person with macular degeneration, how their vision becomes distorted. And there's a couple different types. There's dry and there's wet. Dry is not as severe. Dry macular degeneration, not as severe and much more common. The wet has a more profound impact on vision. However, it's not as common. With macular degeneration, they lose their center point of focus. So they may have peripheral vision, but they lose the center of focus. So again, about 85 to 90% of the cases are the dry type, and 10 to 15 have the exudative type, or the wet. Back to our case study. AO has two different colored socks on. Is this important? Why not? What could you say to him about his socks? It's important to maintain respect and help patients to maintain their dignity. We don't want them to be embarrassed or feel ridiculed. So you'd have to be very tactful in asking him about, the color of his socks, and a careful way to say that maybe just by, making a little joke or something about it. But the reason it may be important, it may just be that he's colorblind, or it may be that he is losing his vision, and that would be something that we would need to address for his own safety. Moving on to the auditory system. Here is a picture of the structures within the auditory system. This is kind of a review. I'm sure you've seen these before. The middle ear consists of the eustachian tube, malleus, incus, stapes, or ossicles. The inner ear is the functional organs for hearing and balance. So if we have an issue with the inner ear, we may be seeing patients that are falling, that are having problems with balance, which could be very, very important, especially in the elderly that are at risk for falls many times because of medications, blood pressure issues. And then if they're getting dizzy because of an inner ear problem, it increases their risk. The transmission of sound is both by air conduction and bone conduction. There's different types of hearing loss. There's conductive and there's sensory neural hearing loss. And again, our inner ear affects hearing, balance, and equilibrium. So for air conduction, external and middle ear portions conduct and amplify sound waves from the environment. That's air conduction. The bones of the skull can transmit sound to the inner ear. which is called bone conduction, and that maybe you've seen that where a tuning fork is used. Presbycusis is hearing loss that comes as a result of aging. There's many different sources for that. It can be from noise, systemic disease, poor nutrition, ototoxic drugs. Some drugs can actually cause ringing in the ears and hearing loss. Also, the buildup of earwax tends to be pretty common in the elderly. Tinnitus is also called ringing in the ears, and that may accompany the hearing loss that results from aging, or it may be caused from some other external factors such as medications or being around noise a lot, working with farm equipment. Some of the subjective data that would be important to gain on your health information history on the patient would be if they have any history with vertigo, dizziness, or nystagmus. Vertigo usually is stimulated by movement of the head, and it feels like people or objects around the person are moving or spinning. Dizziness is that feeling of being off balance. And then nystagmus is it's an abnormal eye movement. It's seen as like twitching of the eyeball, but it can cause blurring of vision with head or eye movement. So some more health information. You would want to know the past health history of childhood illnesses. Of course, there's some childhood diseases that can cause hearing deficits. What about organs that are adjacent to the ear and their effect possibly on hearing? Ototoxic meds we mentioned earlier. And then have they had surgery of the ear or any other treatments? Like previous wax impaction or surgery such as myringotomy, tympanoplasty, tonsillectomy, adenoidectomy, those things should be noted as having potential effects on hearing. Is there hearing loss in the family? I mentioned childhood eye diseases, notably would be mumps, measles, or scarlet fever. Perforation of the eardrum is something that's fairly common. And then, of course, is the ear draining? Is there drainage noted coming from the ear? What kind of medications are they taking? Common drugs like aspirin, antibiotics, chemo, diuretics, NSAIDs, those can cause hearing loss, tinnitus, and vertigo. But they can be, sometimes this is reversible if those medications are stopped. So it's important to know what they're taking to see if that's possibly the cause of their hearing deficit. Again, health promotion or health perception, health management. We want to make sure that the patient has the highest quality of life that they can. Sudden hearing loss most often reported by the patient, but gradual hearing loss is usually reported by a family member. Sometimes patients are in denial or they don't notice that they are having difficulty hearing. And they may wear out their family members by saying, huh, what? And so family may complain before they do that something is going wrong with their hearing. Other things that may be a factor here would be problems chewing or swallowing, dental problems, dentures, clenching or grinding of teeth. That's associated to temporomandibular joint dysfunction, and that's something that also can affect the ears. So again, patients with hearing loss, they may have self-concept issues, they may have difficulty with cognition, difficulty coping, there may be safety issues here, and so we need to try to figure out what's causing the hearing loss and see if a hearing aid or maybe removing cerumen, stopping a med, some way to correct the hearing impairment. So for the objective data, you could look for behavioral adjustments such as